All right, we will just go ahead and get started. It's about 1:02. So we waited a couple minutes just for people to go ahead and join. Welcome to the December 2025 information session for the nursing program here at Oregon Coast Community College. I'm Dr. Crystal Bowman. I'm the Dean of Nursing and Allied Health. So I cover nursing, LPN to RN, nursing assistant, medical assistant, and EMT. This information session is primarily focused on the two-year program, but if you're an LPN to RN student that's interested in that program and you're here, it's still beneficial to stay. We had a session yesterday as well, so some of the information will apply and some doesn't, but you don't have to just leave if you're in the wrong session. You can always touch base with Blake or myself after for any questions that come up. This is what we're going to be talking about today. So we're going to do some introductions, talk about why you are interested in the nursing program if you're a potential student and you're here today, talk a little bit about nursing as a career. Blake is going to share some information on advising. We'll talk about the application and the application process. We'll talk about resources that are available here at the college, and then Blake will also talk about financial aid. So I introduced myself. I will turn it over to Professor Sky to introduce herself and then Blake.
Hi, my name is Willow Sky. I primarily teach first year. So if you're a prospective two-year student, then you will see a lot of me. I'm also the assistant director. Blake.
Yeah, my name is Blake. I'm the advisor or success coach. Those are fairly interchangeable for nursing and allied health programs. And as Crystal mentioned, I'll have a few slides later on.
So we're always curious about why students are choosing nursing as a profession. So if you're here today and interested in the program, this is the class that just graduated. This is the class of 2025. It was a big one. We're just interested in hearing what one word best describes why you want to be a nurse. You can come off of mute and tell us, or you can also put it in the chat. We can see that as well.
Hi, good afternoon. My name is Veronica. I am going into nursing because I've been a medical assistant for years. I currently work at Samaritan Hospital, and I have the privilege to work with really incredible nurses. In fact, I was watching the LPN video that you guys had recorded yesterday, and I saw Cameron Vasquez, who graduated as a nurse, and he is a leader. Like he is just a natural born leader in the ER. And I admire his bedside manner, and I just see a lot of it just seems very rewarding. When I worked family practice and oncology, it was the same thing. It's very rewarding, but as a nurse, I believe that it's more personal. For me personally, I see nurses as heroes, and they step up and they advocate. Again, we have an ER nurse that recently helped a cardiac patient that happened to be one of my colleagues' husbands. And the way that she just advocated and got him to where he needed to be, advocated for him. I mean, I recently went up to her and I just told her, thank you so much for everything. You pretty much saved his life. And so because of that, I do believe that there's a huge sense of responsibility as a nurse. With that responsibility, so you have the opportunity to open up so much doors for people that need the help. And I just want to be there and advocate for people and be able to do that. And what a cool way to, just retire and knowing that I made this impact in my community. So that's why I want to be a nurse.
Thank you so much for sharing. Yep, Cameron is a past grad from here, and as is his wife. And you'll probably recognize a lot of other people in this picture if you're familiar with the Samaritan systems. It's a really small community, and Samaritan hires a majority of their new nurses from us. Shelby in the chat said, I found that it was an attainable career option that sounded rewarding, but also challenging. I was also affected by the nurses that helped my daughter through her type 1 diagnosis and admire them so much. So a little bit of giving back what you and your family was given. That's great. Perfect. Yeah, there's a lot of reasons why people become nurses, and As you enter the program and progress through it, Professor Sky, myself, and all the faculty tend to get to know you really well and learn a lot more about you. So why us? Why Oregon Coast Community College? We pride ourselves on smaller class sizes than major community colleges. We are growing. We're actually one of the biggest community college programs now in the state of Oregon. This is largely because we've done a lot of work to increase our NCLEX pass rate, which is sitting at 96% right now. And we have the most competitive LPN to RN program, which has definitely increased at least our second year class size. The current class size of first year is 33, right, Willow? Right around there. Somewhere around there. The current,
Yeah.
yeah, the current class size of second year is 53. So definitely a little jump there. We believe in personalized interactions and making our program feel like a family. Students get extremely, extremely close to each other. They get to know each other. We get to know you too, where we really take pride in that. We are hugely present in the community. Every student is required to do 24 hours of community service every term in the program, except for the capstone term at the very end. So we're present in the community. People seek us out and ask us if we can help them. We do a lot of food drives, diaper drives, vaccine clinics. We have an open door policy. Every student that's in the nursing program is assigned a mentor, faculty mentor. And we pride ourselves in you being able to talk to anyone within the program, any faculty member, following a chain of command, of course, for certain situations, but we like to be accessible and here for you. Our program is less expensive than a lot of other places. And like I previously mentioned, we do have a high success rate with that NCLEX pass rate. And that's due in part to a lot of work that we have done getting you used to the new type of next gen NCLEX questions, teaching you how to study, teaching you how to take notes, and our mentorship program. And it was mentioned, this is Cameron Vasquez. He graduated from our program and went on to be amazing as a nurse in the ER. This just speaks to the fact that Oregon is a very high paying state when it comes to registered nurses. You can see in Oregon, the average entry level nursing wage is $39.26. If you work for Samaritan, you do make more than that. They do tend to start you out higher than the entry level and pretty close to that median range wage of $45. Top range 52, 56, just depends where you work, what hospital is, what hospital system it is. And that's not going to go down or away anytime soon. Because as you can see, this is the employment outlook for nursing. And nursing, we still are working on a shortage of nurses. And we're trying to increase enrollment and increase the healthcare pipeline within Lincoln County. And we are doing that. But a lot of this is in part to an aging population. And that aging population also includes our workforce, our nursing workforce. So we're trying to graduate and replace nurses as much and as fast as we possibly can. The 10-year projected growth rate of nursing as a profession is almost 17%. That's also not changing. When we talk about the 2-year degree, we also always want to encourage you to go further and reach higher. The next step after an associate's degree would be a BSN degree. And we are honored and very proud to announce that OCCC has joined forces with 6 other community colleges to form a Bachelor of Science consortium. So effective in 2026, we're going to begin offering our own Bachelor's of Science and Nursing program. That means that Oregon Coast will confer their own bachelor's degrees. This program is 100% online except for the capstone course. And it's very unique in its experience in that we have chosen to do 3 different capstone routes. One is leadership and management, in case you're someone that wants to go on and be a charge nurse or a hospital or outpatient setting leader. One is hospice and palliative care, and then one focuses on vulnerable populations like adults in custody, the houseless population, maternal child stuff out in the community, public health. So we're very proud of that. Information will go on our website in January about this program. The application will be open in June, and the program starts in August. We also are proud to have joined forces with Grand Canyon University to offer concurrent enrollment. So there are students that don't want to wait to get their bachelor's degree program. So Grand Canyon, Cole Parker, the advisor from Grand Canyon, he always comes and speaks to you during like the first couple weeks of the program. And he'll tell you about the program and how you can attend Grand Canyon at the same time that you're attending OCCC. And the classes at Grand Canyon are during your breaks. They cross over just a little bit. It becomes a really personal choice about whether you want to take on a really demanding nursing program as well as a bachelor's program. Above and beyond that, once you're done with your BSN, again, you can go higher and further. It's really limitless what you can do. You can get a master's degree, you can teach, you can become a nurse practitioner, a nurse midwife, a nurse anesthetist. All of these specialties require 1 or 2 years of grad school that usually lead to a master's degree or higher. Take it away, Blake.
Hi, so yeah, I think I already mentioned who I am and kind of what I do. And then, so actually, I'll say one quick thing here. So I'd say the majority of what I do is work with pre-nursing students. So we have a lot of students here that are working towards their prerequisites, things that they need to prepare to apply for the program. So I do a lot of that through the application process. And then once students are actually in the program, they will have an assigned nursing faculty that has an advising role, and her name is Angela. And so you'll kind of transition to her for probably most things once you're in the program, but not necessarily everything. I'm still here to check in on something that she might not know. Financial aid's one of the biggest ones there as well. If you have any financial aid questions or issues, you can kind of still use me as a point person as well.
Sorry, it's stuck.
No worries. And so yeah, so basically, if you're a prospective student and you're not taking classes with us, but you think that you will need to take classes, you will probably want to make or take classes with us specifically. You want to always make an advising appointment with me. We're going to take you through the process of getting started as an Oregon Coast Community College student, what that looks like. If you are likely not going to take classes with us, it's kind of as needed. So I have an advising document that's on our website, and I can send it to students initially. So sometimes that can start out as like a quick conversation through email and see where it goes, and that might lead to an advising appointment. Or maybe we can figure a couple things out and get you going on your way and get your questions answered. We're not doing LPN to RN pathway today, but if there are some in here for LPN to RN prospective students, I also have advising sessions set up specifically for that group as well on my advising page, if that's your pathway. So yeah, kind of mentioned it. Any missing prerequisites, good to have that conversation. We can help out with that. My email's there. I'm on the website, faculty directory. We have an advising page where you can find me. Same with Angela. She's also on the website. If you are wanting to make an appointment, some things just to be mindful of. You can bring or send unofficial transcripts. If you know for sure that you're going to apply this, like for the future cycle of applications, so for right now, that's in January, it's coming right up. It's also good to get started having your official transcript sent over to us. And that's a two-step process where you'll send it to us, of course. And then there's a second piece that sometimes students will miss, which is sending in a transcript evaluation form. And that's on the advising document I mentioned. It's also something we can talk about. We'll just check in about your goals, make sure you're going down the right pathway. If you're just getting started and you don't have any previous college credits, we'll have a little bit of a placement conversation and make sure you're ready for college level math and writing. We'll have that conversation. Financially, it's kind of a big one for basically for anyone if you are planning on going to the program. Some might have a bachelor's degree, which means they might not be eligible for Pell Grants. If you don't have a bachelor's degree, then you could be. It kind of depends on your financial situation and other factors, but it's always good to send in a FAFSA if you're thinking about using other grants or loans. But that'll be a conversation we can have. And again, if you're brand new to college, or maybe you just have a little bit of experience, you would probably go into a new student orientation that would get you signed up for. So hopefully, once you get connected with me, just being more familiar with navigating our kind of nursing area, the nursing webpage on our website, definitely knowing what prerequisites you need. When I meet with students, I create a planner and I send that planner to them so they have an idea of what they're going to need for not just the next term, but all the following terms as well. And we can adjust that as needed as we work together. Um, there's a point system that we utilize to accept students. I think we're going to go over that in a little bit, so I won't go too deep there, but that's usually discussed during our appointments as well. So you kind of know what you're working towards as far as getting, good grades in your classes and other factors that can help you get in. Yeah, and as I mentioned, just kind of what classes you're going to need to take until you apply. So this is a sample planner. If a student was starting from scratch, this is generally what it can look like. If you just want to go for prerequisites for nursing, these are all the specific courses that you need. So kind of getting going in writing and math is usually where I have the students start, and then building in the other credits. The one thing I'll point out that's really important here is you'll see that biology 112 in the spring. That's cell biology. It's a prerequisite for all of these second year courses that you see here, the anatomy series, nutrition, microbiology. So that's a key that kind of unlocks the door to go into your second year prerequisite. So that's super important. So I always tell students you want to kind of get on that as far as registering right away for spring term, especially. So yeah, one other thing I think I'll point out here is some of these are technically co-requisites. Those four classes are the arts and letters, the nutrition, the biology 234, which is microbiology, and then the last part of the anatomy. It means that technically you don't have to take them in order to apply for the program, but we highly, highly recommend getting those done for a couple of different reasons. One, back to that point sheet, the more points that you can accumulate, the more competitive you're going to be, and all of those classes are worth points. So that's one really big reason. And the other reason that we'll probably end up talking a little bit more about later is that it's an intensive program. And so if you don't have to worry about any co-requisites or general classes, that's a good thing. So those are two reasons. All right. So yeah, as far as like if you need to reach out to me, if you have a question about anything, we can always be a point person. We can at least get you connected with the right person if you're not sure about something. Definitely if you're struggling academically or financially, we can have that conversation. We have like a specific position, actually. Her name is Tracy. So if students are kind of struggling on the fringes, whether that's maybe even just gas money or rent for 1 month or something like that, sometimes she can help students out to support them so they don't have, so their academics are not impacted. And just a sounding board for decisions. And then sometimes we'll reach out to you, general check-ins, early alerts. So sometimes if an instructor is worried about a student, maybe their grade is slipping or they've missed 2 or 3 classes in a row or whatever it might be, they might reach out to us as advisors to check in with you as well and see if we can get you some support. And then for my caseload, I'll send out a handful of announcements throughout the term. Not every week, but maybe almost every week. We try to get something out every other week, maybe, just about deadlines and information about classes, registration reminders, etc.
Now, we do have a lot of resources available at the college, and we just wanted to share some of those with you. Of course, Blake is a resource. Professor Seiler as your advisor is a resource. Professor Sky and myself are resources for you, as are the rest of the faculty. We have a really good library that has private study rooms that are first come, first serve. They are primarily utilized by nursing students. It's hard to get one because there's so many nursing students that use them. First year has classes Mondays and Thursdays, and second year has classes Mondays and Tuesdays. So there is a little bit of staggering of that, but just be aware of that. We have math and writing labs at certain points of the year. We have tutoring services. Um, it's going to be really good too, because the second year students have been really great about putting together tutoring programs for first year students as part of their community service. So we have that extra layer of support there as well. I mentioned the mentoring program earlier. Every single nursing student within our program is assigned a faculty mentor, and there's requirements for meeting us. You have to meet with us at least twice a term and after any test in which you don't meet benchmark. So we keep a really close watch on your grades and try to reach out and help you as much as possible. There's Ben Kaufman. He's the Associate Dean of Student Affairs. Blake referred to Tracy a little bit earlier. She is the Student Resource Navigator, and she can help you. Like he talked about gas. She also has great information about if you're struggling with food insecurity or housing insecurity. She has a lot of tips there. And then we have a student government, and we have a bookstore that has really good food. Any other ones I missed?
I'll just throw, one other out there, which is both the library and student affairs offer out laptops to check out term by term. And so if you maybe had a laptop that's giving you some trouble, or you're just struggling to find the tech needs that you have, just keep that in mind, that you can come right when the term starts or even before the term to check out a laptop.
Thank you. I meant to add that one in after yesterday and I forgot. Oh, this is you.
Oh, yep. So financial aid, I touched on it just slightly, but essentially we're looking ahead to next fall. That's when the new cohort starts. Um, you want to make sure you fill out the 26-27 FAFSA if you are considering taking out loans, or to see if you're eligible for Pell Grants. So I'd say the sooner you get on that, the better. If you haven't done it yet, definitely fill that out. Um, if you are not a current student and you feel like you want to take a class winter or spring, the 25-26 FAFSA is available still as well. One last thing I'll mention about FAFSA is I mentioned that it's for grants and loans. So if you are taking out loans, the max is, don't quote me on the exact number, but it's around 9,500. The first 3,500 is subsidized, so that means that you don't have to pay on the interest while you're taking classes and currently a student. And then the remaining funds are unsubsidized, meaning that it does accumulate interest, so it's going to be a little more expensive in the long term. So those are just the kind of things to be thinking about as you're planning for the nursing program and the costs associated with it. And I also like to point out scholarships. There's kind of three main ones that I like to tell students about, and one is you see the OregonStudentAid.gov or OSAC. They have early bird deadline scholarships through February 17th, and they have really hundreds of different scholarships that you do have to filter through and search for it. But if you're willing to kind of put that time in, you can see if there's any that you're available or that makes sense for you, I should say. There's definitely a lot of nursing related ones through that website. And then the hard deadline is March 2nd for OSAC. And then Ford Family is another popular one. It does depend on your age and situation a little bit if you are eligible, but there's one that is for 25 years or older students going for an associate. So a lot of applicants could potentially apply for that one. And then the one that I really like to point out the most is we have a really high rate of students that get some sort of funding that end up applying for it, and that's our own foundation scholarship. That's a little bit later than some of the other scholarships you'll see. It opens in February, but that's on our website. So if you go to there's a scholarships page underneath the tuition and financial aid drop down on our website. and you can go there. So definitely, I'd say mark your calendar for February and make sure you apply for that foundation scholarship and see if you can get a little extra support that way.
But we'll talk about the application and the application process itself. The application will open on January 5th at some point during the day, and it closes on March 31st at 11:45 p.m. And there are no exceptions to that. So we can't take any late applications. So if you email me on April 1st and ask me if I can still take your application, the answer will be no. That's for equity purposes, and we keep our application open for a really long time. So we really like people to plan ahead and get that application in, because then starting on first thing in the morning on April 1st, we have a lot to do to process these applications and get moving. This part is probably the most confusing part of the application process, and I'll have Blake speak to this a little bit as well. So you do have to apply in two different places for the nursing program. First, you need to fill out an OCCC application, and you can start doing that already. It's right on the OCCC homepage. There's no cost to apply. Admission is open to anyone with high school diploma or GED. You just fill that out. And then Blake talked to you about meeting with him, setting up an appointment, and then getting the transcripts ready. This is an important step because it starts the process of you getting an OCCC email address. That is necessary because once you apply, once the application closes, I will not send you any communication to an outside email address. It is a perfect setup for a FERPA violation, and we're just not interested in that. So all communication goes to your OCCC email. So you need to fill out that application, activate your email, and then set a reminder or have it forwarded somewhere or have it alert you when you get email to that email address. Starting on January 5th, you'll be able to fill out the nursing application. That will be located on the nursing webpage. Make sure that you fill out the 2-year degree one and not the LPN to RN one, unless you're interested in the LPN to RN program. There is a $200 application fee that helps pay for the admissions test that you're going to be required to take and all of the work that we have to do with processing applications and admitting students. You don't really have to turn in anything except for your letter of recommendation, and that will have instructions in the application of what you need to do with that. Simply it's once you apply, you need to email me your letter of recommendation. Supplemental items will be required once you're accepted into the program, but not until then. So things like your background check, your drug screen, your vaccinations, and your CPR certification. Blake, did I miss anything that you feel like is important about the OCCC app or anything?
No, I think you covered it. I guess I'll just highlight it one more time because it's so important, and that's to be checking your college email throughout the process, and especially after the application closes, for some follow-up items. So just make sure you're doing that. And then maybe one question for you, Crystal, and if you don't know, I can check with the registrar because I can't totally remember from last year. For the transcript evaluation form, if you're a student that has taken all of your credits with us, we still like them to complete that. Is that
Correct.
true? Okay.
Yep, it's correct. Yep, because then we have the same file on everyone.
Okay. Got it.
It's just easier when they're here.
Yep. And it shows, yeah, that way they can see exactly that they have all the prereqs,
Yep.
how they fit in.
And these, Blake talked about them a little bit earlier. These are all the prereqs to getting into the program. I wanted to highlight it again because I think some of the most common questions that Blake and I will get and do get from now until the application closes is, I'm taking this in the spring. Can I still apply? I'm not taking this till summer. Can I still apply? We do take those on a case by case basis. I'm trying to figure out the easiest way to explain this. You do need to complete all the prerequisites, but there are situations in which we understand that it won't be complete. For example, if you are scheduled to take like MP 111 in the spring term and the application closes March 31st, I'm still going to take your application. You just won't get any points for that course. So the prerequisites that aren't done will cost you points, but you'll still be able to apply. There have been situations where Blake has talked to me and said, I have this student, they're taking their last prerequisite over the summer. Will you still accept their application? The answer to that is yes. And if you're accepted into the program, it would be a conditional acceptance. And the condition is that you complete that summer prereq before you start the nursing program, or your seat goes to somebody else. Blake, do you have anything to say about that one or clear up anything I might have confused people about?
No, but if I get a student asking, I usually include you on it
Yeah.
to make sure, because it's more of an exception a little bit. So yeah.
Yeah, Blake and I tend to work together on these. We don't approve all of the requests. It really depends. Like a couple of examples is if someone is saying, I'm going to take 4 prerequisites in the summer, it's hard to do. It's hard to do. So we want to make sure that it's reasonable. And also, I like to protect you. Like, I don't want you to pay an application fee if it's impossible for you to get into the program. So we'll have those, or Blake has those honest conversations as well.
Yeah, usually it would probably just be 1 or maybe 2,
Yeah.
because it's all you're putting yourself at a disadvantage as far as getting points too. So
Then once you're in the program, this is your curriculum. And these are everything that you have to do to complete the program is on this one sheet. You can see the progression of nursing courses as well as all the prereqs and the co-reqs on here. Blake has access to this too. If you have any questions, he can also go over that with you, or you can also reach out to myself or Professor Sky. The reason that I added this year is because we have a lot of students that want to take concurrent classes. So just this year, we had a couple students that were taking like a bio class as well as NUR 141. And it definitely affects your ability to manage your time and be an active participant in the nursing program. As Blake said earlier, this program is intense. It is 12 credits. And there is this calculation that says that for every credit hour that you're taking, be prepared to spend 3 hours out of class studying or doing work. So you look at that and you're doing that 12 times 3. That's a lot of hours that you have to dedicate outside of class to assignments and clinicals and everything else. So it doesn't give you a lot of time to take other classes as well as manage work-life balance. So I just like you to see what the program looks like as it progresses. This is the point sheet. I don't know why it still says fall. The current point sheet is on the website already. I'm making like slight tweaks to it before January, but for now it's still valid. So it's a couple pages long. I just want you to be familiar with it. The point sheet is a requirement that you send me with your application as well. So you'll send me your point sheet and you'll send me your letter of recommendation. It's okay if you fill out your application like January 5th and then you send me your point sheet and your letter of recommendation later. As long as I have it before March 31st, it's fine. So this is like a worksheet for you. And I think Blake can help you with this too at one of your appointments if you have one with them. So it's for you to fill in. This is when I took it. This is the grade I got because we want you to be accountable and responsible for your own points. And it serves as a cross check for us too. So you can see it has all of the prereqs on it. It has the co-reqs. It has the other things that we offer points for. And this is not current on the form, but I have information coming up. I just want you to see what the point sheet looks like in general. But this is for you, except for you all as entering into first year, you will not have an interview. I left it in for the purposes of today in case we had any LPN to RN students that showed up today. So if you have an active CNA license, CMA license, EMT license, if you worked as an EMT, QMHA, anything professional like that, and you've worked 1,040 hours in the past 3 years, you will fill out a work verification form also on the website. That also has to be to me by March 31st. And then you get 10 points for that. If you have an existing associate's degree, you get 5 points. If you have a bachelor's degree, you get 10 points. If you have a master's degree, you get 15 points. You will get 2 points for every course that you've taken that applies to the nursing program, up to 16 points if you took them here at OCCC. Your letter of recommendation, we grade it on a rubric. The rubric's posted, and that's 20 points. You will be taking a Kaplan entrance exam. That's 20 points if you meet the benchmark, 0 if you don't. You will be coming onto campus to take an essay, and that's 20 points. Rubric again, no interview for you. And there's an additional 10 points for military service. There's 10 points if you work for the Samaritan Health System, and there's 10 points extra if you are a Lincoln County resident. Our application process is 100% point based. So if I have 40 seats available in the program, the people with the top 40 points get the first seats, and the rest of you will go on an alternate list. So the most popular questions that we get is how many students will be admitted. My target goal is 40 for first year. And if we get more applications than that and we feel like we can handle it, then we will possibly admit more than 40 students. That is how many we admitted this last year, and it worked great. What is the minimum number of points you need to get accepted? I can't tell you that because it's kind of like a curve. The person with the lowest point sets the benchmark. So there's no answer to that, but we still get asked it. I think I already answered if you're still working on prerequisites. I answered when the application opens. When will you know if you're accepted is a big question. So the application closes March 31st. You can plan to take your Kaplan entrance exam sometime in April. You can plan to be invited to an essay session on campus sometime in May, and then you will know if you're accepted in June. And please keep in mind that any communication about any of these things goes to your Oregon Coast email, so please make sure you get that set up. Professor Sky, do you have anything to add? Any questions that you know that were asked a lot?
No, I think you pretty well covered it.
Okay. Blake, any other questions that come up routinely for you that you feel like we should answer?
Just the scheduling. I have a lot of questions about what's the schedule. They want to know details about their schedule and balancing it with potentially working and things like that. That's what I get the most of probably.
Okay. Well, we can tell you a little bit because schedules for fall obviously they aren't planned yet, but you can pretty much plan to keep Monday dedicated to the college because Mondays you have class, and then Mondays are exam days typically. And then Thursdays are your exam days, and that's also the days that you typically have clinical conference. So those 2 days are pretty much booked for you. Then you also do clinicals at the hospitals or Avamere or other places within the community. So you're dedicating 3 to 4 days a week to the college, to the nursing program. Some weeks is more than others. Some weeks are less than others. I will tell you that we cannot say don't work while you're in the program or anything like that. What we can tell you is that you should reach out to students that are in the program. And what they will tell you is that it's very, very hard to work full time in this program and be successful. Has it been done? Absolutely. Do people struggle? 100%. But that's something that you have to make a personal decision about. This is all of our contact information. Blake and I are your primary contacts from now to when you're admitted into the program. But there is a complete list of faculty on the website. And then I did add Professor Seiler's email address on here. She will take over as your advisor once you're officially admitted into the program. But that doesn't mean that Blake goes away. You can also reach out to Blake at any time. We work really closely together all of the time. So if you go to him and it's something I need to know about, he'll reach out to me. And then if you're talking to me and it's something I need help with, I reach out to Blake. We're all here to help you. So I will stop sharing this and see if there's any questions from anyone in attendance.
You mentioned a mentorship program. What is that? What does that look like?
Yep, great question. So every nursing student is assigned a faculty mentor. So in first year right now, your faculty mentors are Professor Sky and Professor Seiler. So each one of them have half the class. So you're required to meet with your mentor sometime between the first day of class and the midterm, and then the midterm and the final. And then we also require you to meet with us anytime that you are not successful on an exam. Our exam benchmark is 76%. So if you get a 74% on an exam, we expect that you'll meet with us. And then we have you complete a mentor survey, and that just tells us a little bit about you. Do you work full time? What are your study habits? What is your learning style? What is your family structure? Are you worried about anything? So that's our way to start getting to know you better. And it was designed as a way to reduce attrition and increase retention in our program so that we can graduate all the nurses that we admit.
It's basically an extra layer of support just to make sure that you don't fall through the cracks, that we're watching out for things that look like, ooh, this could be a problem if we don't step in now and give you some extra help, some extra support.
Did that answer your question, Veronica?
Yes, it did. Thank you so much.
Of course. Are there any other questions that any of us can answer for you?
Yes, actually, just to go along with Alexa's question in the chat, would you recommend if we are taking classes during winter term and the term does end like mid-March, would you recommend that we wait to do the application until after those classes are done to get the extra points, or would you recommend just doing it, just getting the application done, even though we're still during winter term taking those prereqs?
No, that's a great question. So you can still apply for sure, because we don't actually start actually calculating points until April. So by then you will have finished your class. And then as long as we get those transcripts pretty quickly, then we can still give you points for that class. So I would say go ahead and apply in the winter term.
Okay, awesome. Thank you. Can
Yeah.
we send like updated transcripts, like our first transcripts in the beginning of the application and then update transcripts, or would you just recommend just sending them as soon as possible?
Blake, what's your recommendation on that?
I feel like either way is fine. I mean, as long as you get it, like you mentioned, they're going to calculate. It has to be done. It has to be in before March 31st, or by March 31st. So if you wanted to wait until you finish up those classes and get those grades in, and then just do the evaluation form, then that's totally fine. Just make sure you're on it, right before. Or if you feel a little more comfortable just having an initial one done and then doing a follow-up once those grades are in, that's fine too.
Okay, awesome. Thank you guys.
Any other questions? If you do come up with questions or think of something that you should have asked us or wanted to ask us afterwards, please feel free to reach out to myself or Blake, and we will be glad to help you. And just remember, application opens January 5th, closes March 31st, and we're here to support you every step of the way and hope to see you in the fall. Thank you for coming.
Thank you.